Thanks so much, Jonathan, for joining us, and also all the work that you did on the resource as well. Let's start off by introducing ourselves. I manage Equally Well UK, and it'd be great to hear a little bit about yourself and how you've fed into Equally Well UK.
Jonathan Bickford, I'm a GP and I work in the community, and I also work in two mental health settings, two psychiatric hospitals, where I address the physical health of our inpatients. And so, as we all know, that is a health inequality, one of the greatest that we experience in our NHS. And it is my interest and passion to address that health inequality, and hence my association with Equally Well, because that's all of our objectives, to promote and achieve better physical health for our patients who also experience mental ill health. We've been talking about the pandemic of COVID, and I've been working in the hubs addressing COVID infection. In fact, that is where I am at the moment, but we're on a pause between patients, so it's good to be able to talk to you.
No, thank you so much for taking the time. So the resource, as you know, we broke down it into sections. We started with smoking and COVID, and I wondered if you could just share a little bit of information around the importance of quitting smoking, and also having support from a medical professional in terms of medication and the changes that might cause.
I'm always going to support, promote, talk about smoking cessation, regardless of the time. And of course, it becomes an even greater issue when considering an illness that affects our lungs, a respiratory virus. There are a number of risk factors that may make people more vulnerable or otherwise regarding COVID-19 infection, and smoking is one of those. So it is another reason to consider that. In terms of smoking cessation, yes, one knows that achieving stopping smoking is best achieved when it is alongside the support of somebody else, a healthcare professional. And historically, we did that ourselves as GPs, although it is now shared out with other organisations. So depending on where you live, here or I'm a GP, it is addressed alongside a team from the council, and they will support and prescribe as well to support smoking cessation with the things that you're probably aware of, things like nicotine replacement. There's also a couple of tablets that people can take as well, and then there's e-cigarettes, all of which are good options. And so the other thing I think to consider in smoking cessation, and people will know this, is that when smoking, the damaging component of cigarette smoke, the tar, has an effect on our liver, so that it speeds up some of the things that the liver does, and it's the liver that metabolizes, that gets rid of some of the medications or other things that we ingest. So people that smoke, that take medications like clozapine or olanzapine, or another group of benzodiazepines, lorazepam, diazepam, those people need bigger doses for them to have the same effect if they're smoking. So if one stops smoking, fantastic. Another for which there are enormous health benefits regardless, but it also means that it is quite likely that you're going to need a smaller dose of medication. So two things about that. One is just to be aware of it if somebody does start this, to stop smoking, that and maybe discuss that with the person that prescribes the medication. If we're going really by all the guidelines, one would have a blood test after a week of, say, to check a dose such as clozapine or olanzapine with a view to reducing it, because it is thought that you could reduce the dose by even up to 50%. And I'm particularly motivated to talk about that because the other health issue that we can come to, but as we all well know, is that the whole world is facing a struggle regarding carrying extra weight. We're all looking at that, but if one takes medication, lipolanzapine or clozapine, you've got an even greater challenge regarding it. So to have the lower doses one might be able to achieve has that aspect of improving physical health as well.
That's incredibly helpful, I think, for anyone that's on high medication doses. It's quite a good incentive from what we've learned from our expert by experience members. And then, of course, the amount of money that you can potentially save, which is another added incentive into helping towards quit. But as we've said in our resource, if you're planning to quit, please do get in touch with your GP or medical provider. As you touched on ever so slightly just then, the other thing in our resource was around healthy weight management and eating and exercise, which can be quite tricky at the moment, given people needing to shield and being in lockdown. Is there anything that you're able to sort of suggest or recommend, or anything that within the settings that you're based in that you've learned that you can share with us?
We know from our resource on equally well regarding how to maintain a healthy weight. Firstly, I don't underestimate for a second how the great challenge that is for all of us. It's difficult, and that document shows the difficulties that everyone has been facing. So with my patients, we've had some who've done really well, and some are still struggling. And so the messages that we promote are: one, if you can do it alongside somebody else, like a health professional, that helps. So what would be fantastic would be a dietitian, or even just a conversation with any healthcare sort of professional. We all know about the benefits of losing weight and discussing that. I mean, what I promote, for which there is good science to set out, is just focusing upon a diet that we can keep permanently, long term, and that is what I would just call real food, as opposed to as real food, as opposed to what so much of us eat at the moment, which is processed food and with high sugar content. So, I mean, sometimes people say that if you're buying something that's got a big label of all the different ingredients and it has to have a sort of a color code system to work out what it is, that isn't real food. So what I mean is fruit, vegetables, nuts, pulses, which may not seem enormously appealing, but that is if you can do that, the weight will take care of itself. So yes, it's looking at a change of diet like that that one can sustain, and to really consider expectations. Look, this is hard for all of us, and it may take not a few weeks or months. This may be something process over a period of years, but I can't yet also stress how it is such an important project to work on, because this is the absolute pathway to good health. It is stopping smoking and then being able to achieve a healthy weight, because as we know, the rate of diabetes throughout the world is increasing, and in my patients at the hospitals, that is probably the main condition I am addressing. And to remember, it is entirely preventable and reversible. So if you're looking at facing these conditions, there is great optimism, because it can be addressed, albeit in making these significant changes forever regarding diet. And when you can, best of all, to do that alongside exercise. I mean, that is the most effective way, and that's the magic pill. That's what we all want, and we can get it through those two things, combining it with exercise, the healthy diet, smoking cessation.
Some of our expert by experience members have shared similar experiences. So we've got a few that had diabetes, and through diet they've changed that, all with different things that work for them. So one of them decided to go plant-based, and he said that really helps him, and his plant-based journey means that he focuses more on eating fruit and vegetables. The only downside is, as vegan food is on the rise, he keeps seeing cakes, which he has to look away from.
Wow.
But one of our other members said that he ended up buying lots of nuts and dried fruit and put them in the cupboard instead of packets of crisps or anything.
Brilliant. Brilliant.
And his carer really helped support him. So he acknowledged that he feels incredibly lucky to have a carer who's his PA, and he spoke to her about providing just healthy food so he doesn't go to the shops, because if he goes to the shops he ends up picking up the other food. So yeah, I think, as you say, it's about finding a diet that works for you, or potentially working with a dietitian on that, which is incredibly useful. The other that we had in the resource was exercise and building manageable expectations for yourself. I'm not sure if you're like me. I dip in and out of fitness sometimes, and there's moments where I will do sort of a 10-minute workout, and other moments where I feel a lot more energized, where I'm going to do a full hour's workout. So it's about managing our fitness levels.
It is, doing it gradually, and step by step would be a good mantra. And the other thing I'm going to keep going on about is sugar. You can make the change that you can sustain, because you can always look for where it is. Although that's high sugar, that I need to change. And then again, just doing step by step, one thing at a time. We as human beings experience this very positive sort of reward when we eat things with sugar, and it's a grey area, but consider that perhaps that it reaches the spectrum of almost being an addiction type thing. So trying to swap something gradually. So fruit does have sugar. Dry fruit has quite a high content of free sugars, but that's still, so you're combining that therefore with fibre, and therefore you're getting health benefits. So that one, again, step by step, maybe swapping that sweet thing for a healthy sweet thing, as you say, like a piece of fruit or some dried fruit, would be perhaps achievable things that people could start to do over a longer, a decent period of time, over a year or two.
I think that's always a good suggestion of step by step. And then the sort of final thing which you helped with was around medication. And during the current situation, we heard that there's a number of people that haven't been seeing their GP because they don't think that they're able to. So we really wanted to acknowledge that GPs are still around and they are still able to support should someone need it. Have you got any insights into the situation and how you might have adapted your services? And obviously not sharing details of conversations, but conversations that you've had with people that might help others to feel more inclined to contact their GP.
Yes, so general practice has changed quite dramatically in the last couple of months, but everyone is still there and everyone is still working, albeit differently. So nearly everything will start with a phone call, but we have lots of phone appointments. In some ways, at the moment, in my own experience, it's a little bit more straightforward to access a GP. So first of all, just you can book a telephone appointment, and then in turn, if needed, you can see a doctor as well. We're obviously wearing PPE at the moment, but you can do so much by the telephone. In terms of medication, I feel strongly about this, that if you experience mental ill health, it is almost certainly the right thing to just keep taking it. So don't run out. And if I was your GP, regardless of whether I've seen you or had a phone call with you, I'm always going to err on making sure that the prescriptions continue whatever happens. And if anyone is going to change it, to do that in the context of having a good think about it and a discussion. And if that's not feasible at the time, I would always err on continuing it, as we all know, changing it or stopping it in a way that's not really organised occasionally creates difficulties, occasionally leads to relapse of mental health problems. And of course, the same does apply to physical health. If you're diabetic, really must continue those. And And so as GP practices, I think we are all ensuring that that happens either through a phone call or just through a message, or using the online system to get repeat prescriptions, or via the chemist that you normally go to. They can also organise it. I'm hoping it is reasonably straightforward for everyone to continue to take, or to get access to continuing their medications.
No, that's incredibly helpful.
You mentioned one or two concerns regarding if people are unfortunate enough to experience COVID infection and go to hospital, do the wider hospital team, do other healthcare professionals realise the impact and the importance of the medications that our patients take? Well, firstly, I would have thought that they most certainly that they would. But again, very occasionally in my career, I have seen once or twice a medication stopped. I mean, immensely rarely, not for several years. So yes, I think it's good to be mindful of that. In terms of in combination with COVID infection, there's really only one circumstance where that I've experienced, that one might consider a change or stopping medication, and that is the virus in some people does reduce white cells called neutrophils. And for those patients taking clozapine, we know we have regular blood tests to keep on our whites, to keep a track of our white cells. If somebody experienced a considerable drop in their white cells and taking clozapine, that might be the only time ever one would consider, I think, changing medication. And then even then, I think it's immensely unlikely. Certainly in the several weeks that I've now been doing this, we have not stopped anyone's medication. And it would be a really, really thorough and careful consideration if we were to consider that. And as it stands, no one has met that criteria.
No, I think that's incredibly important. Also, we did briefly touch on if someone does get COVID, the after period where energy levels might be low. You mentioned that you are in a COVID setting. In terms of when people are starting to get better, what have you found? Have you found that people are a lot lower on energy, or if there's anything else that people might need to just bear in mind to help their recovery?
Yeah, that's a really good point as well. And I would say I'm still learning about that, as we all are, about this virus. And I suppose what I have seen is variation. As we know, some people, it appears, have had the infection without any symptoms at all. And similarly, there's a whole spectrum to the other end where the symptoms could be so devastating. I think the majority of people have made a full and quickish recovery over a short period of time. But there are some patients I've seen, in fact some today, where the symptoms have been lasting for some weeks, such as patients with a cough that's gone on for a period of time, and absolutely the fatigue. In fact, today, without losing confidentiality, I think I've seen a patient who returned to work after 4 weeks but just felt exhausted by that. So, and I think the right thing for her was therefore to have a longer period of recovery. She's probably one of the less sort of common, but I think one should look up, be gentle on yourself and give yourself. This is a really serious, very dangerous virus with a great variation how it affects people. And if you haven't recovered, then take your time and do the best thing for you, which might be a longer period of recovery. I think my feeling from assessing patients is that if you are fortunate enough to have other health problems, for example, maybe diabetes or other sort of long-term physical health conditions, it's quite likely that it might take a little while longer to return to your usual self. But on the other hand, I certainly expect that to happen, although just give yourself time.
No, I think that's a perfect message to end on, in terms of things work different for different people. Give yourself time and be kind to yourself. So thank you.
And if I'm not sure, the service around responding to COVID, or hopefully just normal primary and secondary care, is still working and everyone's there. So if the degree of uncertainty, it's always best just to check. You can ring. If I was your GP, I'd want you just to have a quick word with me.
No, perfect.
Right.
All right, thank you so much, Jonathan. And the resource will be linked below in the YouTube video. So thank you.
Thanks, Emma. Nice to speak to you. Thank you.
Thanks.